GP clinics here in Singapore are reporting a spike in COVID-19 cases in what an expert describes as a perfect storm caused by Omicron and festive closures. Now, one clinic says that it's seen a 20-fold increase in patient load, and like other GPs, that's affecting its ability to treat those who are ill. Geraldine Yap with this report.
These patients arrive at this 24-hour clinic expecting to see a doctor. Instead, they're asked to leave and come back later. It's been a common occurrence here, where waits can take as long as 45 minutes.
After every single COVID patient we see, we do a wipe down of our clinics, and then that would be a downtime of about 20-30 minutes before we can start seeing new patients again. And then when we get another COVID patient, the whole process starts itself again. So that does hamper our ability to see more patients.
According to the doctor, this can happen up to 20 times a day as the clinic gets patients whose regular GPs may be closed for the Chinese New Year. Omicron is an issue not just in the clinics but outside too. Some clinic staff have had to isolate as a precaution after close contacts were infected. This Toa Payoh clinic has had to ask staff to work overtime while hiring more part-timers.
On usual days, we probably have like 2 or 3 clinic assistants that's working. So for the past few days, we have actually increased the number to maybe 4 or 5 clinic assistants working on shift. Our working hours have also extended. Normally, we have 1 doctor on shift, but over the past few days, we have actually run 2 consult rooms in the clinic itself.
Under what's known as Protocol 2, patients who are mildly ill are channeled to GPs instead of hospitals to protect capacity. And that's why the surge in cases is expected, according to a specialist.
It's more of a case of bad timing, where we have the Chinese New Year period together with food poisoning, a lot of revelry, and in turn, MC seekers perhaps, and at the same time, a new spike in COVID cases. I think it's just a coming together a perfect storm. In the next few days, as more clinics open up, I expect the numbers to fall.
Despite thousands of new COVID-19 infections reported every day, the number of serious cases remains relatively stable. There were between 9 and 16 patients in intensive care each day over the last week. Some experts believe that with repeated infections and vaccinations, the illness will eventually be so mild that the infected will not even have to see a doctor.